Hello everyone, Dr. Beth here. I want to talk about comprehensive blood panels and the difference between what I may order and your primary care practitioner. So first off, why do I order a comprehensive blood panel? It's important for you to make sure that I understand systemically all over body what's going on. It's really critical that when we're doing all these advanced testing, whether it be a stool test or a hormone test or a toxicity type of a panel, that I look at truly the foundations. And in this comprehensive panel, yes, I'll be looking at organ function, liver, kidneys. I'm going to be looking at a basic lipid panel, even though often I'll go further into particle size. It's important that I'm also looking at foundations of electrolytes, which is often on a comprehensive metabolic panel that you get from your primary care, your annual physical. But often markers that are not checked are a complete thyroid panel, not just a TSH. This also includes your free and total thyroid hormones. It includes antibodies. Hashimoto's is the most common autoimmune diagnosis today, Hashimoto's thyroiditis, which we can identify through looking at antibodies to your thyroid. It's really critical that I'm looking at not just your fasting blood sugar, but looking at your average blood sugar over 3 months. And this is called a hemoglobin A1C. So many people are not checking this, and it is absurd. 50% of us have prediabetes, diabetes today. That's 1 in 2 Americans that you're testing. So I really hope that we're testing for prediabetes and diabetes, and a hemoglobin A1C is one of the best ways to diagnose or understand that. But we're also looking at fasting insulin. Insulin is the hormone that helps to regulate and bring glucose into the cell for use. And so often, we're not always seeing the diabetes, but we are seeing that insulin resistance. We're seeing that the insulin is rising and the glucose is rising beyond what is optimal. And so it's really important that we're looking at those types of metabolic markers, as well as looking at uric acid. We often think of this in gout, but it's beyond that. It's looking at, is there metabolic instability? Is there metabolic dysfunction going on? And we're looking at markers of liver enzymes, but also one particularly called GGT. And this actually is more specific to looking at the level of the liver and toxicity. And we're looking at foundational nutrients such as vitamin D. Most of us know the importance of this, but I can get into that at a different point. Looking at magnesium, looking at B12 and folate, 2 of our foundational B vitamins. Looking at not just serum iron, but a total iron panel, including ferritin, which can not only be a marker of storage of iron, but also can be a marker of inflammation. And other markers of inflammation include HSCRP. This looks at systemic inflammation. It is really correlated to cardiovascular inflammation, vascular inflammation. We're looking at homocysteine, which can be a marker if elevated of need for B vitamins or issues with methylation, which many of us have these little genetics that don't allow us to methylate well, which is one of our detoxification processes. And another marker of potential weakened immune system or immune dysregulation is an ANA, which looks at autoimmune potential or weakened immune system. And so there's a lot of different tests that we can look at, but it is really important that foundationally we are looking at a comprehensive blood analysis for safety, making sure as you start our program that we're understanding that things are functioning at least at a minimum where we can bring support through nutraceuticals or nutrition lifestyle, obviously. But it's really important that we're looking at that in conjunction with the other tests that we're doing. You know, for me, I don't just look at each marker independently. It is really looking at that cohesively, and also respecting that when you go to your conventional medical doctor, they're going to look at these normal ranges. And I like to do this because there's a difference between normal amongst, you know, all the population, which you're an individual, and optimal ranges. And so any functional medicine practitioner that you see is going to look at ranges in a very different way, and they're going to actually walk you through what's optimal, not what's normal, because we should all be trying to be optimal beings. And so that's differences on a comprehensive panel from your primary care practitioner or conventional practitioner between what we at Root Cause Medical Clinic look at and why we look at these types of tests.